morning, Dr. Falabi. Good morning. We are glad you are here, and I want to welcome everyone here this morning for this webinar celebrating World Malaria Day with the rest of the world. Media Initiative Against Malaria decided to celebrate theirs today. I want to welcome everyone here this morning, and I'm very, very sure that by the end of this conversation, we will go home with very important information on how we can manage malaria, how we can eradicate malaria from Nigeria as a whole. I read somewhere that the Nigerian Health Ministry stated that they will need over ₦1 trillion to eradicate malaria in Nigeria. That would be a very awesome thing if they do that, because malaria has been a killer disease for several years, and children, nursing mothers, pregnant women are basically the major hit by this disease. So today we are looking at Zero Malaria Start With Me, which is the theme by the World Malaria Day. For the World Malaria Day, draw the line against malaria. We have to draw a line against malaria. My name is Dr. Mrs. Orievan from Media Initiative Against Malaria. I will just do a little introduction on Media Initiative Against Malaria. It's actually an NGO. It's a global coalition against the killer disease malaria, with their development and health partners committed to improve the living condition of citizens through advocacy and action-based strategies in 2 key areas. And these 2 key areas that Media Initiative Against Malaria looks at are the Media Malaria Summit, which holds annually. It links eradication to information and generating and creating necessary awareness. The summit held annually is designed, among other things, to bring stakeholders together to define their vision for malaria and their community, analyze the economic implication, and establish clear priorities for actions and areas of intervention. And secondly, citywide and nationwide advocacy to improve the living condition of the people, especially the vulnerable group, through proper environmental condition as a preventive measure, and the use of insecticide and insecticide-treated nets in accordance with the communities or schools without malaria initiative. I once again welcome us to this summit. It's actually going to be, it's not going to take much of our time. It's going to be brief. We have a seasoned doctor, Dr. Bamgoye Morenkayo Afolabi. Dr. Afolabi is a seasoned doctor in this area and other areas. And we also want to thank Shalina Healthcare for partnering with us in this program. You're welcome. I can see from Ayo Akinshola. From Ayo Akinshola, you're welcome to this program. And when the time comes, you're going to be invited to take us through some aspects of this program. Thank you so much. I want to just do a little introduction on Dr. Bamgoye Afolabi. He obtained BSc in genetics and molecular biology from Lincoln University, Jefferson City, Missouri, USA in 1978. Excelled as a reserve officer training course, ROTC, US Army in 1978. He obtained MBBS, MSc, and MPhil from College of Medicine, University of Lagos, Nigeria from 1978 to 1991. He also obtained MFH, Masters in Public Health from University of Liverpool, UK. He obtained PhD, Doctorate in Public Health from Atlantic International University, Hawaii, USA. He also obtained postgraduate diploma certificate in research methodology from Indian Institute of Public Health. He obtained certificate in basic health economics from World Bank, Washington, D.C. in 2012. He's the chairman and CEO of Health, Environment and Development Foundation, an NGO. He's a co-founder, senior vice president, director of global health at Pan-African Health Alliance and Collaborative. He's a former national professional officer, Malaria Unit, World Health Organization. Former chief medical research fellow, Nigerian Institute of Medical Research. He has written about 150 papers in peer-reviewed journals, among which papers are initial surveillance of suspected undesirable drug for reactions to some artemisinin-based combination, ACTs, therapies in Lagos, Nigeria, International Journal of Malaria and Tropical Disease. Co-authors are Dunku A and Opera AC. Hyperphenylalanine in children with falciparum malaria, Quarterly Journal of Medicine. Co-author are Enwanuko, Salako LA, Adigbe EO, Al-Hazan H, and Rabi RA. Increased levels of plasma histidine and histamine in falciparum malaria. Relevance to severity of infection, J-neural transmission. Co-authors are Enwanwu CO, Salako LA, Adigbe FO, Bashira Lahu N. Is consultant to NAFDAC on pharmacovigilance, consultant to Rollback Malaria Initiative, Geneva, Switzerland, on global fund proposal writings from 2002 to 2010. Consultant to Federal Government of Health, Nigeria, on AP analysis and on rapid impact assessment. Consultant to World Health Organization on household use of long-lasting insecticide nets. Consultant to West African Rollback Malaria Network. Consultant to Step B, supported by the World Bank on women perception on HIV, tuberculosis, malaria in Southwest Nigeria. Certificate of Excellence Award. Rated in the top 6% of all Nigerian executives based on the company size and international business network strength by Nigerian top executives in the medicine and pharmaceutical industries. Lead consultant to Ghana Health Services Joint National Strategy Plan on DHMIS and other aspects using the JANS tool and guidelines. Consultant to Nordica Fertility Center on assisted reproduction technique. Member, Board of Trustees, African Public Health Enterprise, USA. Member, Nigerian Medical Association. Member, Nigerian Institute of Management Consultants. Former Chairman, Integrated Vector Management, National Malaria Control Committee, Federal Ministry of Health. Dr. Falabi has achieved so much. I'm overwhelmed. He has some community responsibilities. He was installed as Bashegun of Okeibo Kingdom in October 2019 because of his community involvement. Installed as community leader of Ibeshel Island in 1994. With this, I want to welcome Dr. Afolabi. He's going to take us on this topical issue, kicking back malaria. On Zero Malaria, Start With Me. Draw the line against malaria. You are welcome, sir.
Thank you so very much. Can you hear me?
Yes, can hear you.
Lovely. Good morning, everybody. It is a great pleasure to commemorate this year's 2021 World Malaria Day with all of you great people, wherever you are on this planet. I'm aware that Some people are joining us from USA, from North Carolina, and from Arizona. Thank you very much for staying up late. Malaria has been a household word in places around the globe where it is endemic, especially in Africa. So this year's slogan is Zero Malaria Starts With Me, Draw the Line Against Malaria. The line to be drawn against malaria is actually the action that each one of us will be taking from now on. Each and every one of us is a victim of malaria, and thus each and every one of us is a stakeholder in achieving zero malaria status. The slogan, Zero Malaria Starts With Me, Draw the Line Against Malaria, is a clarion call to all of us to take action, no matter how little, no matter how big, against malaria in any way we can. So it is no news again that malaria is one of the deadliest diseases, if not the deadliest, of past and present humanity. We all know that malaria is caused by the bite of Anopheles mosquito that injects parasites known as Plasmodium falciparum into the blood of humans. We also know that there are different families of mosquitoes and different species of the Plasmodium parasite. This address is not a lecture on entomology of mosquitoes, but a reminder that malaria as a disease is still with us, taking its daily toll. Therefore, every one of us, presidents, governors, senators, parliamentarians, traditional rulers, chiefs, village heads, business executives, bankers, civil and public servants, the military, professors, engineers, teachers, students, and frontline health workers have to have a firm grip, or we have to firmly grip the zero malaria movement. Now, the zero malaria movement is a social movement for malaria elimination. It is also a cultural movement and should be considered also a civic movement. It is definitely an aspect of our human revolution for the advancement of Africans and those where the disease is endemic. In the year 2017, it was reported that there were 3.5 million malaria cases that were reported in just 10 African countries than in the previous year, 2016. So, in response to this upsurge in malaria, the African Union Commission and Rollback Malaria Partnership to End Malaria established the Zero Malaria Starts With Me movement across African continent during the 31st African Union Summit in July 2018, based on a campaign originally launched by the Ministry of Health and Social Action of Senegal in 2014 in partnership with Speak Up Africa and an organization known as PATH, or Program for Appropriate Technology in Health. So the Pan-African Zero Malaria Starts With Me stands on a tripod, which includes one, generating political commitment. 2, mobilizing private sector engagement and financing. And 3, increasing community engagement and ownership. Non-governmental organizations and civil society play a vital role in influencing and promoting public dialogue about decisions that affect the lives of millions, while holding government and policymakers publicly accountable. There are reasons why NGOs and civil societies are crucial in this Pan-African movement of Zero Malaria Starts With Me. And some of those reasons include: 1, NGOs and civil society stakeholders can highlight significant issues through their knowledge of local contexts. 2, they offer valuable technical expertise and insight to supplement available data. 3, they suggest innovative approaches to problems. 3 or 4, they provide important perspectives on malaria control and elimination policies and initiatives. So according to Speak Up Africa, the aim is to develop local capacity of malaria champions and reinforce policy change objectives and support national programs, resource mobilization goals, and cross-sectional collaboration. There is emphasis on cross-sectional collaboration, including ministries of health, of finance, of women development, infrastructures, and on and on. So what are the key issues in Zero Malaria Starts With Me? We want to mobilize and empower communities to take action and ownership over the fight to end malaria. In other words, political leaders, private sector, and community leaders should be the drivers of the action to speed up malaria prevention and treatment and to save lives. No child must have malaria. None. And even if the child does have malaria, that child should be seen within 24 hours of the start of the illness. That child should be diagnosed correctly, treated, and tracked. And these are the test, treat, and track as WHO proposes. Communities must be empowered to recognize the dangers of febrile illnesses in children aged below 5 years. There should be a direct linkage between households with under 5s and community health workers through mobile phone and email. Almost everybody has mobile phone, even in the villages. So we should use those mobile phones to directly link up with our health officers in the community. And also, each child should be seen at least once monthly at home or in the nearest health facility. Each child, or probably 2 children, should sleep under long-lasting insecticide-treated net. And also, there must be no stockouts of non-expired anti-malarial drugs in the community. If we do this, hardly will any child die of malaria. All of the above also go for pregnant women, especially those in their first pregnancy, who must have their blood checked also for malaria parasites at their focused antenatal care visits. They must also sleep under long-lasting insecticide-treated nets and must take their intermittent preventive treatments, IPTP 1, 2, and 3, with sulfadoxine pyrimethamine at specific times of their pregnancy. So we have to prevent malaria in pregnancy and placental malaria at all costs. Placental malaria leads to low birth weight babies and other perverse consequences for both the mother and the child. Cumulative days of sick leave due to malaria and other time wastage run into approximately 1,500 man years per day lost in Nigeria. We lose so much time. So there must be constant quantitative, qualitative, or mixed study of e-health on how to improve the health of the community as far as malaria is concerned. My own vision is malaria can be conquered. If humans can get to the moon, if they can explore Mars, Venus, Jupiter, and other planets, why can't we conquer an insect that weighs less than 0.005 grams and which carries parasites that weigh even less? I see a future where Media Initiative Against Malaria becomes a formidable organization with over 100 or maybe 2, 3, 4, or 500 journalists that meet annually with agenda such as: 1, paying courtesy visits to senators, parliamentarians, governors, and commissioners of health, commissioners of women affairs, finance, and so on and so forth, requesting for the establishment of Center for Malaria Research, data collection, and study of potentially potent anti-malaria medicinal herbs, or setting up State Institute of Public Health with strong emphasis on malaria and other communicable diseases, rewarding staffs of institutes that excel in malaria control and elimination, ensuring that funds allocated to malaria eradication are released on time and there is no leakage, and ensuring that there are adequate supplies of equipment such as microscopes, slides, Jameson stains, etc., RDTs, that is rapid diagnostic test kits, to test for malaria in patients with fever, and that there is abundant supply of affordable and efficacious anti-malaria such as artemisinin-based combination therapies or ACT, quinine for severe malaria, and that these patients are tracked for compliance and for pharmacovigilance. Also, the Media Initiative Against Malaria should be able to pay advocacy visits to traditional rulers and community gatekeepers. They should be able to establish and support annual zonal malaria meetings. I know that the Malaria Initiative Against Malaria has its own annual meeting, but they should also establish and support annual zonal malaria meeting, that is southwest zone, southeast zone, south-south zone, not central zone, not eastern zone, and not western zone should have annual malaria zonal meeting where policymakers come together and discuss malaria in their zone. Media Initiative Against Malaria should also be setting up, monitoring, and be evaluating sentinel sites, one in each senatorial district in each state, and anchoring these sentinel sites on institutions of higher learning, such as universities, schools of health technology, schools of nursing and midwifery, colleges of technology, etc. in each state. Media initiative against malaria should also take it upon ourselves to ensure that community members are aware of, empowered with, and participate in national or state health insurance scheme. The NGO should produce a documentary on acute and severe malaria for people to see, believe, and take action against malaria. If there's a documentary on how a child fights for his or her life, how a pregnant woman fights for her life when she contracts malaria, when malaria gets severe, then people will start to be taking malaria very, very seriously. Malaria lethality. Now, once a child or a pregnant woman is bitten by a mosquito, which inject parasites into the bloodstream, that child or pregnant woman starts fighting for his or her life. Malaria makes you fight for your life, and the at-risk group of children and pregnant women do not often win the fight. A mosquito bite is as lethal as a bite of a poisonous snake. To this effect, Nigeria loses billions of US dollars to malaria annually from out-of-pocket expenses such as purchase of insecticide, mosquito coils, and so on and so forth. Nigeria loses billions from time lost and from other economic burden. Nigeria loses not only money, but we also lose our children and pregnant women to malaria. Nigeria loses not only money or her children and pregnant women to malaria, but also loses her dignity for its inability to conquer what is commonly referred to as ordinary malaria, which consumes the lives of millions. And as I said earlier on, Nigeria loses about 1,500 man-years per day for time wastage due to malaria. For example, sick leave that is issued for workers, parents, fathers, mothers, out of school for sick children, time spent on child or self-admission in hospital, and so on and so forth. We lose so much time. Also, we have to consider semi-immune people who must also be catered for. The port health authorities should ensure that visitors to Nigeria have leaflets on malaria at arrival in any air or seaport in Nigeria. In addition, tourism industry loses a lot, and they should also liaise with the malaria elimination program and or with media initiative against malaria. Because in Nigeria, again, we lose billions of US dollars in tourism when malaria is not controlled or eliminated. Tourists go to countries where there is little or no malaria, and they spend their money there. Furthermore, architects and construction businesses are also involved in that houses and fences should be built such that roofs do not contain rainwater, or broken bottles are not used in fences to prevent intruders. Roofs that are horizontal and broken bottles contain rainwater where mosquito larvae easily breed. In addition, communities should also be able to adequately manage the environment. You see that all disused tires are disposed of, cans and tins are cleared, plants that retain water are drained, gutters are also drained. One of the reasons why there's a lot of different species of mosquito in big cities such as Lagos is that there are open drainages, which thankfully the state government is tackling now. Now, Anopheles mosquitoes breed in clean water, but these mosquitoes, it's not known that they are adapting to dirty water now. The other family of mosquitoes called Aedes aegypti, but these are the main vectors that transmit viruses that cause dengue fever. So you see, mosquitoes do not only transmit parasites, they also transmit viruses, such as Zika viruses that cause microcephaly, and other viruses that cause dengue fever, typhoid fever. Luckily for us, mosquitoes do not transmit coronavirus, but don't let's bet on it yet. Let us all be vigilant through research and political, social, and cultural commitment. Please permit me to talk briefly about COVID-19 and malaria. The recent COVID-19 pandemic has eclipsed the ongoing fight against malaria. Since the eruption of this pandemic, about 3.1 million people have died globally. Pharmaceutical giants started producing vaccines against COVID-19 within 3 and 6 months of the pandemic, when only about 100,000 people have died, or even less. As of now, there is no vaccine against malaria because malaria is a disease of squalor, which makes people poorer and poorer. Malaria is a disease owned by Africa. And I'm very happy that the African Union met a few days ago to decide that Africa should start manufacturing our own vaccine and probably other pharmaceuticals for indigenous diseases, such as malaria, such as measles, and so on and so forth, cerebrospinal meningitis. In this regard, I must express my gratitude to the World Health Organization, where I used to be a staff, for supporting the African Union to make her own vaccine. Our political leaders, our financial organizations, our large corporate bodies, and our philanthropies should trust those of us in the medical research field. Our peers in the developed world do not worry about what we worry about in Africa. They do not worry about housing, children's school fees, security, food, and good pay. They do not go on strike. They are well motivated. If medical researchers in Africa are well motivated, they can create wonders and elevate the African continent to a higher status globally. And I believe Nigeria, South Africa, Ghana, or Kenya, or Egypt can produce first-class vaccines against malaria and any other disease. I believe we can win the gold when we work together as a unit and not compete with one another. Malaria does not discriminate, so we humans must not segregate ourselves. And that is the only way we can win the battle against malaria and against any other disease or illness. As a matter of fact, we must see ourselves as a unit. We are African and we must unite. It will be unfair of me if I do not express my gratitude to the Federal Ministry of Health, National Malaria Elimination Program, Abuja, under the able leadership of Professor Osage Hanire, also to Governor Babajide Sanwo-Olu of Lagos State, and to the Nigerian Institute of Medical Research, Yaba, Lagos, under the able leadership of Professor Babatunde Salako, and to all the organizations that have been supporting not only Nigeria, but Africa on the fight against malaria, especially Global Fund for AIDS, Tuberculosis, and Malaria, GFATM, UNICEF, United States Agency for International Development, USAID, Department for International Development, DFID of the United Kingdom government, Japan International Cooperation Agency, or JICA, and many more. I also express my gratitude to our sponsor, Inside Business Africa and Shalina Healthcare Nigeria Limited. We can do it. We can do it. We have to be united. We have to put our mind together. I want to thank you so much for listening to my key address today. And I hope it will spur all of us into action because zero malaria starts with me. Draw a line against malaria. Thank you very much. Obrigado. Vielen danke. Muchas gracias. Eshe púpọ̀ mo dúpẹ́. Dalunu. Nagode. Emiyenka. Niyetiso say asante sana. Ashkurak. Merci beaucoup. Thank you.
Thank you so much, Dr. Falabi, for that extensive lecture on eradicating malaria in Africa generally, not just Nigeria. One of the things I must say that is crucial is that the medical researchers should be motivated. That is the most important thing. They should be motivated by the government and other stakeholders so that they cannot, because I was just thinking, why is it that we can't come up with a vaccine against malaria? Why all these years, nobody has actually come up with a vaccine to fight malaria, like vaccines for other diseases? And from what he said, it's just because they have not gotten enough motivation, funds and all that to go into research to produce a vaccine that can actually fight against malaria, aside the environmental aspect of it, keep your environment clean and all that. Thank you so much, Dr. Afolabi. I want to say that it was an extensive one. I want to also say, if you have questions, please do write them on the chat box, or you can raise your hand up. We'll call you up so that you can ask your questions. I'm seeing, okay, Amarachi, you have a question, please.
Yes, I do. I have a question. Thank you, Dr. Falabi, for that excellent presentation. All right, I picked up something where you talked about we have to prevent malaria in pregnant women at all costs. You talked about placental malaria, and also in one of the slides you talked about anti-malarial herb. So I want to ask two questions. First of all, could you please expatiate more on placental malaria as it relates to a pregnant woman? And also, can a pregnant woman take anti-malaria herbs? If I don't know. Yes, those are my questions.
Okay, you're talking about anti-malaria herbs. Okay. The World Health Organization has not approved any herbal preparation. I do know that some people in the villages and even in the cities, they take herb during pregnancy, but not for malaria. That I know. That we all know. But we're trying to say, please make sure that whatever you take in pregnancy is something that is approved. But we cannot actually control this. Although, not that we cannot control it, but people do go to traditional birth attendants who give them one thing or the other. And this is where research is very important. Why can't we do research on our herbal medicines? China does. Actually, Artemisia annua is a Chinese herbal medicine. And they worked on it. The government of China, the Chinese government supported their pharmaceutical industry with a lot of funds, machinery, and all the technicalities. And they came up with, artemisinin-based combination therapy. Now, we grew Artemisia annua in Nigeria, and the yield was even far better than what occurred in China. We grew it here. And when we presented it, somehow, one way or the other, it was not taken further. I do not know why. I cannot say anything on that now. But the issue now is See, we can do wonders. The Nigerian scientists are the ones who are running these giant pharmaceutical industries. Johnson and Johnson, Pfizer's. We have Nigerians there. We know we do have Nigerians there. But why can't they come and support us? Why can't we should have a scheme, a system whereby we start funding our research on medicinal herbs. Now, let me tell you something that nobody knows. There are some gentlemen from Europe, I won't mention the country. They came to Nigeria, collected our herbs, and went back and worked wonders and made a lot of money in their country using Nigerian herbs. Why can't we do that in our own country? Yeah, because we are not supported. Nobody supports research. Now, getting back to malaria in pregnancy and placenta malaria. Now, the reason why placenta malaria is important is that the placenta is full of nutrients and oxygen which the malaria parasite needs to grow. So once a pregnant woman contacts malaria, the parasites, are taken to the placenta, and then the placenta, instead of being spongy, the placenta is like a sponge. But when it is infected by malaria parasite, it becomes like rubber, like football, and nutrients cannot pass from the mother to the baby. So the baby does not grow, and if the baby survives, the baby is born with low birth weight. And we know low birth weight children don't survive the first 1 year of life. And even if they do, they don't survive the first 5 years of life. So we lose even our unborn babies or neonates to malaria. This is where research is very, very important. I've just written a paper, for funding with a professor in USA to study placenta malaria in Nigeria. We do not know the prevalence. So every pregnant woman, every single one must be seen at our focused antenatal care, check for malaria, and every one of them must take their intermittent preventive treatment 1, 2, and 3 with SP, sulfadoxine pyrimethamine. In this way, we can reduce the mortality and the morbidity to malaria in pregnancy. Thank you very much.
Thank you, sir. I appreciate it.
Thank you so much, sir. Amarachi, I'm sure you're glad he's giving you the right answers to your question. I wanted to invite Mr. Stevenson. Okay, Mr. Stevenson, you're welcome, sir.
Well, good morning. It's still morning. Dr. Afolabi, let me say a very big thank you for this awesome presentation. I'm sure you are aware that if it wasn't because of COVID-19, we would have been at the Muzo Center holding this event, which is what we do every time. Bringing all the nurses and doctors and everybody to come and talk about this particular disease, malaria parasite. I must also thank you for bringing some innovation into it. And then one of the major questions I will also ask you, or maybe it's some of, in recent times, we've been reading, some of us in the media, that a malaria vaccine is being developed. It's about 75% almost ready, 75% efficacy strength. So I don't know whether, some of the local, like you've pointed out the need for Nigerian or any other African country to start doing some kind of, research into how to make our herbs. We have this at Bo, we all know it. And most people are used to it when you're a child and in the village and all of that. It's taking for so long for African countries to appreciate this particular treatment regimen for malaria over years, and not being able to make it into even just make it a syrup, something of that nature. What is actually the challenges that you may have seen, even from the World Health Organization, but for encouraging what has always worked? Especially, I know the pharma companies want to make money. The doctors don't want to hear about herbal medicines, but what is important is cure to to everybody. So I dare, any other person on this platform can actually make contribution to this. We've always wondered, as media initiative against malaria, we've always wondered that we talk about these things, and then suddenly another product is developed for malaria. Before you know it, another artemether manufacturing, then the quinine and all those kind of stuff. But in terms of the local herb that has been developed over time and we're so used to, is it that it's so difficult to actually be able to develop those things into cereals or something like that? I don't know if anyone wants to take the question, or Professor Dr. Afolabi wants to answer.
No, it's not difficult. We just need political backing. We need financial backing. Is it difficult? Maybe 5-10 years ago, we never thought that something like a helicopter or something will be on Mars. A couple of years ago, human beings never thought that a human being could walk on the moon. We never thought that we can get to the depth of the ocean. We never thought that we can split an atom. Things are only impossible if our mind tells us it is impossible. For me, I do not believe that something is impossible. Let us try. As a matter of fact, all these drugs we are talking about, is it penicillin? Is it artemisinin-based combination therapy? Is it quinine that is not from plants? Almost all drugs are from plants. And who has the plants is Africa. Who has the forest is Africa. Where do you find the forest? In Africa. They will say, oh, you forest people. But let us take advantage of our forest. Instead of people being kidnapped and being taken to the forest, let's use the forest as our resources, as our major resources. The forests are there to enrich us, but we must start using our own reasoning faculty. There are people who make cement in Nigeria, and they make billions. There are some Nigerians who are one of the first 10 or 20 billionaires in the world are Nigerians. These people should put money down for research. If they put 0.0001 of their resources into research, it will benefit a lot of people. There are politicians who have so much money, they buy houses in Dubai, they buy houses in UK, in London, they ride cars, they have 10, 20, 30 cars, they have, everything. Let them just put a minimal percentage into research. Let there be a research committee that is above board. Everything is not about money. We have Rockefeller Foundation. These people put the money down. They have a committee, look after this thing, get this thing done for me, do research on cancer. Let me build a research center for you. Let me supply you with the things you would need. I will pay the staff and or whatnot. You see, we just have to sit down and organize ourselves and be systematic. One thing that you agree with me that we don't have in Nigeria is a system. We do not have a strong system or a workable system. Look at our health system. We say we have weak health system. Let us strengthen it. Everything, almost all the drugs come from, and this is where the media initiative against malaria should be strong. They should be the driving force. The media is about the most powerful organization in the whole world. Look at CNN, look at Al Jazeera, look at BBC. They are very, very powerful. And this is a global NGO. So the media initiative against malaria should take it upon themselves to really sit down, have a meeting, pay advocates. As I said, let us start something. We can start small. We don't need to have 200 billion US dollars. We don't need to have that. We need to have just the minimal. Just $100,000 can start something in Nigeria. Then we build up on it. South Africa gains about $200 million every year at their Institute of Medical Research. Senegal gains a lot of money. So does Kenya. All these research centers bring in a lot of money. But let us fund our own medical research center. Let us fund our own researchers. If we don't do it, we become slaves to others. We cannot afford it. That's what I'm saying. Maybe somebody else can add to it, actually. Maybe I have to stop here.
Okay, thank you so much, Dr. Falabi. And I think from there, the media initiative against malaria, we're going to start something. It's actually a promise from here, and please take us by our word. We're going to start something on this, and I know that the media is the most useful tool for any form of awareness or information to the masses. Thank you so much, sir. I saw Dan Direct. I saw your hand up some time ago. I don't know if you have a contribution or suggestion, sir.
Hi, good morning.
Good morning,
And
sir.
I want to thank the media initiative for putting on this event. It is highly important, but it is also very dangerous what you're doing. And I say it's dangerous because we know that knowledge is power. And what you are doing today is increasing the knowledge base, not only in Nigeria, but here in the United States. I was up at 6 a.m. this morning, which is, I blame on my good friend, Dr. Afalabi, for rising me so early this morning in order to be part of this conversation. But I am very thankful to be here. I would like, however, to hear some words about the importance of education, because as we talk about discoveries of new vaccines, it very well may be that the scientists who will discover the vaccine or come up with a strategy is sitting in one of the secondary schools or university schools in Nigeria. So the importance of education and individual responsibility are points, Dr. Afalabi, I'd like you to maybe expand upon.
Oh, thank you very much, Mr. Dan Duret. As a matter of fact, Mr. Dan Duret is the president of Pan-African Health Alliance and Initiative in USA. And I'm sure that many other people in the USA, in North Carolina, in Arizona, they are listening to this. Education is the key to all this thing, definitely. To be very honest with you, we do not have malaria education at primary or secondary school level. We do not. So most people don't even know or have idea of what malaria is, what transmits malaria. You know, a couple of years ago, we did a study and asked people about malaria, and some people said, oh, it's when you eat palm oil that you have malaria. It's when you stay in the sun for a long time that you contract malaria. It's when you work hard that you have malaria. They are unable to link the parasite, Plasmodium falciparum, to the illness. And there's a big gap. Even top people, you know, in the government, they don't know much about malaria. And this is where education is very, very vital. I think part of the curriculum at the primary school level actually should be about malaria. My 2-year-old granddaughter will say, Grandpa, mosquito is biting me. And to me, I mean, she doesn't know about mosquito, but that is an idea that if she is trained right from the very beginning of her life, she can start to develop an idea that what can I do to prevent mosquito from biting me? Where should I go? What are the molecular basis of this? What are the engineering? What can we produce to prevent this event happening? So you are quite right. Education is very, very vital. And as you know, there's a triad of education, agriculture, and health.
Yeah.
Where there is education, if there is no good food, then you won't learn anything and you'll be unhealthy. Where there is health and there's no education, then you are not really that healthy. And where there is agriculture, but there's no health, there's no agriculture, you cannot do anything meaningful with that agriculture. So the triangle of health, education, and agriculture is a very, very vital triangle, and we have to exploit. And I believe from now on, I think the media initiative against malaria will take it upon herself to advocate that we have to invite teachers or meet with commissioners of education. We have to go to communities and teach them about not only malaria per se, about just fever. When your child has fever, this is what it means, and this is what you should do. And as I said in my address, I think communities should be linked to their health providers through their cell phones. Almost everybody has cell phones now, and we must leverage on that to educate ourselves, to communicate with ourselves, to make sure that when there's an emergency, we get there in the shortest possible time. We save children. There's a strong referral system. So I think you have opened a honest nest by the word education. We need to be educated, not only on malaria. Of course, malaria could be the arrowhead, because actually, when a child has malaria and the immunity of that child is lowered by malaria, other diseases come up, like measles, like meningitis, like any other thing. And mind you, malaria actually runs hand in hand with malnutrition. You see, most children who have malaria are malnourished, or if they are not malnourished, malaria makes them more malnourished than when they didn't have malaria. So we are talking about something that's very, very important here. Thank you very much, Mr. Dan. Durrett.
Thank you.
Thank you so much, Dr. Falabi. Thank you, Durrett, for waking you up this early morning. Thank you for coming and your contribution. And Dr. Falabi, it's great. And I just got in a triangle now, a vital triangle of agriculture, education, and health. I think that is going to be I'm going to put it as a placard in my chest, my head, and all over my body. So when I'm sleeping, I'm thinking of agriculture, I'm thinking of health, I'm thinking of education, and none of this survives alone. So we must need education, educating our people on this malaria or other health issues. And we must also put in place the agricultural aspect of it, because if there's no food, our immune system may actually not be developed enough to fight against these diseases, and then we must have good health. Thank you so much. I love that. I love this triangle, and it's going to be my password this time from today henceforth. And we're also promising that we are going to also look into these areas, the Media Malaria Initiative Against Malaria. We're going to look into these areas, promising to get other stakeholders involved, the government, the community leaders, private people, and all the health ministries, and see what we can do, and also engage or collaborate with the agricultural sector too, and the educational sector also, to actualize this dream of having healthy environment, healthy nation, healthy community. Thank you so much, sir. I saw a hand. Ifeanyi, I saw a hand. He has a question or a contribution to make, please.
An opportunity for tech enthusiasts in research, because we know that tech is really good. There is almost no.
I think he's asking if there's anything those the IT people, those people in tech can do to actually help in the fight against malaria. I think that is what I can get from what he's trying to ask, but I think he has audio issues. Is there anything these young men who are tech savvy can do to help in the fight against malaria? I think that's the summary of what he's, aside the medical aspect of it, is there anything the technology savvy people can do to also help in fighting against malaria?
Yeah, there's medical engineering.
Sir?
There is medical engineering.
Okay, there's medical engineering.
Right. Those people who manufacture machines for x-rays, who manufacture laser for surgery, they are not medical doctors. They're just engineers.
Mm-hmm.
There's also the legal aspect of medicine. There is the IT aspect of medicine.
Okay.
Like I said, that, supposing there is a woman in the village who has a cell phone, can we have a program on the cell phone such that she can connect with her doctor immediately, so that she can know exactly the temperature of her child, and that temperature can be sent immediately to the health worker? Supposing a woman is start labor at home, how can she call for help? Maybe she's in the farm or something like that, and nobody's with her. There's always room. Always room. We just have to sit down and reorganize ourselves. We have to meet. We have to, discuss, dialogue amongst us. And this is why I'm saying that the media initiative against malaria is a key. You cannot do this on your own. The IT man cannot say on his own or her own that, oh, I want to do this to do my. No, it's not possible. But if you belong to an organization and you bring your idea to that organization, and the organization supports you, the organization makes, okay, we have an IT group on malaria, and this IT group is producing a program so that you can know exactly when the child is having malaria. We can know exactly how many parasites in the child's blood. We can know exactly what is the temperature. If the temperature of the child is rising, you can get an alarm. Like you get an alarm when they send you money. So why can't we get an alarm when the child's temperature is rising? Okay. So these are where our IT specialists can sit down. We can meet. We can discuss. We can. If they don't have these ideas, they won't know what to do. And ideas alone are not important. We need funding. We need support. We need political support. We have to test what we are doing. We have to pilot test. We have to do research. Is it okay? Is it sustainable? How well can we do it? So these are the things that the media against malaria can be a place where people can come to, where we can organize people and get them into the field with support. But alone by yourself, if I'm alone by himself, you can't do it. It's not possible for you to do it. So in other words, we have to get ourselves together. We have to collaborate. We have to form an alliance, and then have a dream, have a goal, have a vision, have a mission. What exactly are we going to do? Have a goal, aim, and objective, and then push forward. We can fail, but there's nothing wrong in failure. Almost every successful thing fails first of all before. As a matter of fact, if you don't fail, you can't win. So this is the main issue. Okay. let's get together and we'll discuss further.
Okay, thank you so much, Dr. Falabi. Eric Michel is saying that, uh, yes, you touched on this, but he wants you to expand on the importance of sanitation, clean water, and hygiene in the fight against diseases.
Okay.
You touched on it, but he wants you to please a little bit expand on that. The importance
Uh,
of sanitation, clean water, and hygiene in fighting against diseases.
Thank you very much. I know that Eric Mitchell is connecting with us from Arizona, and he woke up, but he didn't sleep to 3 a.m. because it's about 3, 4 a.m. there,
Yes.
and I sincerely appreciate the dedication of this man. They are fantastic. I've touched on clean water and sanitation. You see, there are different species of mosquitoes. Anopheles mosquitoes are fine ladies that prefer clean water where they breed. Aedes aegypti are ruffian. They breed in bad water. But you see, these days, Anopheles mosquitoes are adapting to bad waters, unclean waters, that is the gutters of Surulere, the gutters of Abia, the gutters of Kano, the gutters of Lagos. That's now we are finding Anopheles mosquitoes adapting, to those bad waters, those dirty waters. So if you have dirty water, be sure that not only Aedes aegypti mosquitoes that carry virus are breeding there, there will be also some Anopheles mosquitoes that probably they don't see clean water to breathe, so they are now adapting to dirty water. So what is the implication of that? It is that we now have mosquitoes that carry both parasites and viruses. And that has not only health, but also economic importance. And this is where sanitation comes in. Malaria actually, to be very candid with you, thrives where there is poor sanitation. Malaria malaria also thrives where people are poor, and it makes people even poorer. So this is where environmental sanitation is extremely important. We must galvanize ourselves and ensure that there is no open drainage in Lagos. There shouldn't be. If you go around Lagos, especially, Mushin, Surulere, Agege, Bariga, and all these other places, Ajegunle, the gutters are mainly open. And, the world has gone far, far, far beyond that. Far, far, far beyond that. So we really have to catch up with the world. I must give you an example. In some certain parts of West Africa, Ghana, that I know, where I stay for a little while, you hardly find open gutters. They do it. We must take it upon ourselves, both at government level and at community level, to make sure that there is no open gutters. Okay? So this is one of the issues. Now, the health of the people is connected with the environment. We depend on the environment. Mosquitoes too depend on the environment. But because we are not able to control our environment, mosquitoes thrive. If we are able to have a very fantastic environmental management, then mosquitoes will not thrive. Or rather, maybe malaria will not be a big issue for us. Malaria was wiped out in most Western countries, Southern USA. There was malaria in Southern USA before, malaria in Italy before, And one key issue is for us to defeat malaria, we must elevate the living condition of the people. The living standard of our people is so low that there's always diseases, death, and poverty. If we elevate the living standard of our people, then we will not be subjected to most of these things that easily defeat us, like malaria, typhoid fever, cerebrospinal meningitis, measles, and all whatnot. We won't. I know it's a big deal, but we can do it. We can do it. Okay?
Much, sir. Apollonia is saying that attitude in this part of the world is a big issue. There are people that don't want to, commit to taking action against this malaria. They refuse to sleep under the net. They refuse to, take simple tests before treatment of malaria. People just go to the chemist and take any drug when they have headache and all that. They are not convinced about the do's and don'ts of treating malaria. And she's asking what should be a message to such people who refuse to take any of these advices that are being given. They don't think using the treated nets is important. They don't think taking tests is important. Now we are talking of taking this information to the community and all that. What should be the message to such people? Somebody's asking that question. If we actually have to take this message down to them who don't believe in such things, so how do we relate this message to them? What should be the message we should send to them?
Okay. So I worked in the Gambia for a little while, and what we did there is called positive deviance. Those who believe should be able to show the outcome of their belief. You see, let them know that, see, if you don't do it, it's you that will lose. Not only do you lose money, you will lose your child. You will lose your pregnant woman, your pregnant wife. You will lose so much. And those who do it, those who sleep under the net, will not actually they will not actually lose much or not lose at all. So the positive deviant is a study. We have to show them. The people who don't believe in these things, they may be learned, but basically they are ignorant. They may have education and degrees, but they, in this aspect, they are illiterate. And it is our responsibility, those of us who know, it's our responsibility to show to them that this is what can be done. And it is not only you that is suffering. There are many others. And this is why I was saying that Media Initiative Against Malaria should actually produce a documentary on malaria. If you produce a documentary on malaria, how a child fights for his or her life, severe malaria, the child is in hospital, they're looking for blood transfusion, they're trying to get a vein, the child is in coma, or the child is convulsing, and the mother is there crying. I've seen all this throughout Africa, but I'm all alone. I do not want a child, a Nigerian child, an African child, or any child to die of malaria. They don't believe. That is their negative attitude to life. If they don't believe, then what do you believe? They believe, oh, if we drink agbo, I'll be okay. Yeah, but you may not be okay. Oh, if you go to Babalawo and you do this, it will be okay. Yeah, but you may not be. So it is our responsibility. And this is where research also comes in. Let us show it to them, through research, that this is what we are facing. And another thing about it is that there is no strong policy. You just walk into a pharmacy or a drugstore and buy any drug, and then you go. It means that is actually a weak health system. You cannot do that in Ghana. You can't go, or in Togo, you just cannot, you dare not actually. Or you go to, you are in England, or you say you have a headache, you want to go and buy a drug, you know you can't do that. If you try to do it, you go to jail. But because of the laxity or lack of system in Nigeria, we have no system, or the system is not working one way or the other. You know, people can just go, I want to buy ibuprofen. Why do you want to buy ibuprofen? Oh, I have a toothache. Then you're using ibuprofen. Oh, I want to buy cataflam. Why are you buying cataflam? Oh, I have weak low. Oh, I have fever. Then I want to buy this drug. People actually buy drugs that is not concordant with the illnesses they have, and that they don't know that they become poorer and they lose, and their illness does not abate, and now they ensure, resistance. They are basically ignorant, and we that have the knowledge, we must showcase our knowledge. We must become not only scientists, we must also become teachers. We must be patient enough to ensure that we elevate everybody to a very enviable position. That is my own stake on it. That's my own view. And I think that if we do it this way, if our politicians, if our policy makers, if our government and policy makers and decision makers are able to meet with us researchers, and they are able to draw policy based on our research, all of us will be the better for it. But most policies in Nigeria are not based on research findings. And this is why I'm emphasizing on research. And because of that, it filters down to the community, to people, and people just do anything they want to do because there is no policy backing their, their nonsensical behavior. Okay? So we have to get ourselves together and get the policymakers on our side, meet with them, sit with them, dialogue with them. This is what we want to do. Your policy must have a research base. Well, let us do the research, and we'll give you, the report, and then you can write your policy based on our research findings.
Thank you so much, Dr. Afolabi. I don't know if Mr. Festus Oseji, do you still want to ask? Okay, I think he has a question. I can see his hand up. Okay, you can go on with your question.
Hello.
Yes, go on with your question, please.
Dr. Afolabi, I just want to appreciate you for your time, and also for the wonderful message that you have passed across through the platform today. I have some vital question here, which I want to kind of through, so that you can help us as a professional to help us and look at it. One of the questions is this: why is there no malaria in the Western world, as in the Western countries? Is malaria, is it an African problem, or African, I don't know how to put it. But another question, number 2, says drugs. A lot of researchers have done something about the drugs, against malaria, treatment of malaria and all that. Is it that mosquitoes in Africa are also doing research to fight against those drugs, or why is it that we have different types of drugs to treat malaria, and upon that, nothing seems to be happening? Because I know my forefathers also suffered malaria. My father suffered malaria. Even today, I'm still suffering it. And it's obvious that my children also are going to suffer malaria time to time. Is it that the professionals, I mean the researchers, the medical researchers, there are some certain things they are not doing right? Or is it because of the financial gain that makes them not to come up with at least a final solution to it? Or is it until all the mosquitoes in Africa are killed, that is only when we stop having the malaria in Africa? Those are my questions. And if you can use your position as a medical personnel to give answers to some of these questions. Thank you.
Yes.
I think his first question is very, very
Let's see.
interesting. Why is it that there is no malaria in the Western world? Now, the issue is there was malaria in the Western world. There are mosquitoes now in the Western world. But you see, for example, in southern USA, in Florida, Mississippi, southern Georgia, and all those places, there still are mosquitoes, but their mosquitoes don't carry parasites. Okay? They've made it such that their mosquitoes don't carry parasites. That's number one. In Italy, they dredge all the drainages, all the stagnant waters in Italy were removed completely because they found out that that was the source. Actually, the word malaria is an Italian word. Malaria, bad air. So they thought that where air was bad in the swampy area, that is where the mosquitoes originate from. So they went to the swampy areas and drained. Okay? Not only that, they now improved the living standard of people. In the 1930s, during the First World War, the British Army was stationed in Yaba and Apapa, and they were dying. And the British government then drained all the stagnant water in this area so that their soldiers in Lagos would not die. And that was why at that time there was no mosquito in Lagos. Even if there was mosquito, it was very, very little. But today, because of overpopulation, there's no drainage, everybody goes, there's open gutters and things like that. There was a time when Russia, Greece, Italy, Spain, USA, Cuba, they have malaria. But what did they do? Not only did they drain all the stagnant water and actually engage in environmental management, they also went ahead to improve the living conditions of the people. We are not able to improve the living conditions of our people now. Most Nigerians are still living in mud houses in the 21st century. And the deaths due to malaria occur mostly in rural areas. In urban areas, you can have access to health facilities and things like that, but in the rural area, they don't. So they die a lot there. So this is where environmental management in raising the living condition or living standard of people, not even there are rural areas in the big cities. We have to improve the living standard of Nigerians. Then if you do this, then we will have won the battle against malaria at least 30%. The other thing you talk about is the drug. And I said before that, you see, all these things, what the Western world has is research. That is the key word. The Western world developed on only one thing, only on research. Without research, the Western world would never have developed. It is only research. They did research on plants, they did research on water, they did research on soil, on minerals, on leaves, on everything. And this is where you have, in the USA, for example, where I grew up, you can never be a professor without doing research upon research. And if you don't continue doing research, you will not be funded. How many of our professors in Nigeria are funded to do research? Most of them are even rusty. They don't know, they just teach and then no more research. That shouldn't be allowed. All these professors should be funded to be doing research and be submitting their research to the government. Not just teach and say, oh, I'm a professor. You're a professor of what? When you're not doing research. We have to be engaged in research. You see, I mentioned Artemisia annua. Did you know the Chinese government actually gained about 20 billion US dollars in the first 10 years of their production of artemisinin-based conditioning therapy? About 200 billion US dollars for what the Chinese gained. And then they reinvested. Nobody invests in research in Nigeria. Nobody. If we invest in research, then the entire country will be transformed dramatically within 5 or 10 years. See, let's look at the malaria parasite. When it gets on the body, it goes into the liver and multiplies and changes, comes back into the blood system, goes into the liver and comes back and reinfect red blood cells, break down the red blood cells. Now, if you look at that, if you follow it, we can know exactly. If I can target this thing, maybe it won't go to the next stage. This we have vaccines. This is how vaccines are made, you know. So if we keep doing the same thing, we won't go anywhere. It's like the other day I was going to an island in Lagos, and the boatman was still rowing the boat the way his father and his grandfather were rowing the same boat. It's the same thing that Oseji was telling me, that his father had malaria. Well, couldn't do anything about it. He had malaria, couldn't do anything about it now. And then probably his son will have malaria. But now we must be able to do something about it now. And the first thing we have to do about it is to make sure that we generate political commitment to research. Private sector also should be engaged to finance research. The community must be ready to also support research. All this I'm saying is based on one thing. What is research? Is to find out, why are we dying? Why are our children dying? What is killing our children? What is killing our people? You know, as far as malaria is concerned, we know malaria kills, but how does it kill? Why does it kill? When does it kill? How do we prevent it from killing? This can be answered by research, not by just, oh, okay, let me go and do it. Without thinking, we will die, and we will continue to die. You see, let me divert a little bit and go to the road traffic. You know, the road traffic accident that occur, some of them occur due to busted tires, isn't it? It's because we buy used tires from overseas, we put it on our car, and we are speeding, and then the tire busts on highway. I saw one this past weekend along Ife Ibadan Road. The tire busted, and the guy, you know, the car went into the ditch and they died. You know, how if we don't do research, we keep on dying, we will perish, and we've been perishing. This is what we have to stop. We have to start doing research to save our people, to make sure that we are okay. It is only Nigeria, especially, that what is disposed of, what is useless in other countries, are sent to Nigeria. And you know what they tell us? Oh, you Nigerians, you are shameless. You Nigerians, you are useless. We have to kill all of you. And that's what they tell us. And I'm saying, no, we are not useless. We are not shameless. We are people of dignity. But we have to go further than that. We have to work together. We must not be divided. We are divided, so people see us as weak. Let us come together. Don't say, oh, I'm Yoruba, I'm Hausa, I'm Igbo. When we say that, we have defeated ourselves in the first instance, and everybody defeats us. But let us all come together and see how we can improve Nigeria from perspective of health, especially from the perspective of agriculture, from the perspective of education, the key issues. And then we'll see that even your father won't have malaria again. You won't have malaria again. Your children will not have malaria because you know what to do. You know when it is coming. You know how to attack it. You know how to conquer it. So this is the essence of research, of education, and of knowledge.
Thank you so much, sir. It's been a wonderful time with you, and you've actually touched every area about this. And in fact, the most important thing is that in Nigeria, like you said, we don't have systems. If we have systems, we don't maintain the systems. There are no policies. If there are policies, they are not enforced. Everybody does just anything. Otherwise, we will see people on the highways selling agbo, and people are just drinking what they don't even know what it is. And people just take medications without, thank you so much. I just don't want to go into that. It's really great being on that this lecture per se today with Dr. Afolabi. Thank you so much. I'm sure nobody has questions again. If you have, just hang it on there. We're going to call you back. But I just want to call up on Shalina Healthcare. Shalina Healthcare is one of our partners in this program. He's going to say a little bit about Shalina Healthcare and their products, and so far what they have been doing. I know that Shalina Healthcare Nigeria is a multinational company with presence in so many major countries in Africa. They have their headquarters in Dubai, and they have a lot of quality products and affordable products, even products for malaria. I welcome Ayo Akinshola. He's going to take us through some of the things that Shalina does and some of their products, so that we can have access to some of their drugs for fighting malaria and probably some other diseases. Welcome, Farm Ayo Akinshola, please.
All right, thank you very much, Dr. Ori. Just like you introduced, my name is Ayo Akinshola. I'm a pharmacist. I'm the head of training and capability development. I bring everyone good tidings from the management of Shalina Healthcare. It's a privilege to listen to our own very Dr. Afolabi, and I count it worthy to have been under his voice today. He has dwelt extensively on the issues of malaria, vis-a-vis the debilitating effect in tropical Africa, which Nigeria represents. I want to quickly show us and tell us that malaria, it's a big problem. And that is why most pharmaceutical companies in Nigeria today market one form of anti-malaria or the other. At Shalina, we ensure that our medicines have good quality, they're affordable, and they are always available. If I have to go by one of the lines that Dr. Afolabi said, that we must ensure that there are no stockouts of non-expired anti-malaria drugs in our community. This is what we strive to ensure in Shalina. And I'll be talking to us today, showing some few slides, talking about the company Shalina, and about 2 or 3 slides to show our brand of anti-malaria. I crave your indulgences. Whatever questions, please hold them. At the end, we take them together. So Shalina is present in over about 13 countries in Africa today, in West Africa, East Africa, and South Africa as well. And currently in Nigeria, we are situated, our head office is in Lagos, Nigeria. And we have a factory coming up. By the turn of this year, we should have a factory ready for local production as well. And our current plant is 100% export oriented, based in India. Our regional headquarters, national headquarters, is there in Dubai. And we also have approvals for our products in Nigeria by NAFDAC, in Ghana by the FDA, Ministry of Health in DRC, in Ivory Coast, Ministry of Health. And we have our factories ISO certified 9001, 2008. That means it's certified for consistent quality delivery output. We currently, in Nigeria, market about 64 products, about 66 products, and they cut across so many therapeutic areas: antiepileptics, anti-infectives, anti-inflammatory, anti-malaria, gynecology, gastrointestinals, nutraceuticals, respiratory. And we are still looking at more other therapeutic areas. Some of our products you may know, they have been in the Nigerian market for over years. We started with the Ibuka, Epidam, Super Apeti. Those are our early products. But as I said earlier, we have about 66 products currently being marketed in Nigeria. And these are produced from the ISO certified factory in India. As I also said, some of these products will also be manufactured locally at the turn of the year. Our plant is almost ready on Lagos-Badon Expressway, just beside our Tribune House on Lagos-Badon Expressway. And our product stands for quality, efficacy, affordability as well. We also engage in CSRs and community development activities as well to promote great health across the countries we operate. We do anemia detection camps. We organize malaria detection camps. We also do antenatal camps in hospitals, deworming camps where we deworm the communities, right, from children of 1 year and above. We also organize Shalina market clinics, where we also go around to the clinics, introduce our products, make sure we do some ready tests, malaria tests, anemia tests, eye tests. We engage with partners, medical partners who also conduct these tests. We also do free child treatment and also hygiene parcel distribution across our communities as well. Also, the antenatal camps, the deworming camps, and medical outreaches are some of the patient-oriented activities we undertake. Some of the pictures of what we have done, even during World Malaria Day, how we have also interfaced with agencies and partners like Malaria Initiative. So currently, we market our brand of ACTs, artemisinin-based combination therapy, which is the #1 registered recommended by WHO, and our brand is called Charlatan. Today we have about 6 different baskets, 6 different products in that basket. We have the Charlatan 4, which comes by 6. We have the Charlatan dispersible for children, which they can drop in water for little children, and they can just take the water. We have the Charlatan suspension as well for children, and we have the Charlatan by 24 tablets, the one by 18 tablets, and the one by 12 tablets. So basically, we have our Charlatan is available and cuts across all age groups. Any of our children, whatever age group of our children, will always find one of our brands, Charlatan brands to use. So we start from the children to the adult, different brands to choose from and treat effectively your malaria. We know that the doses, which I must emphasize, most of the time, I think Dr. Afolabi did not lay emphasis on this. Most of the times, some of our people will tell us that they have taken a brand of anti-malaria and that they didn't get that requisite treatment or relief. I must state that there's a dosage schedule for the first day of treatment. Right. After the first dose is taken, the next dose for that day should be taken 8 hours after the first dose, on the first day, on day 1. 8 hours after the first dose. Right. Going to day 2, the moment the first dose is taken, for example, you take the first dose at 9 a.m. in the morning, the next dose must come 12 hours after. That's 9 p.m. The same thing on day 3, 9 a.m., 9 p.m. So for day 2 and day 3, the time space should be 12 hours. But for the first day, the time space should be 8 hours. 8 hours after the second dose is taken, 8 hours after the first dose. Most of our people miss this out, and that does not ensure that loading dose needed to commence our treatment. So as I said, we have the disposable tablet depending on the weight group of our children, disposable for the children, and the tablets 18 by 18 by 12 by 24 for categories of people. Then again, it is also known that anti-malaria, the ACTs, is best absorbed when taken with fatty meals or milk. Please ensure that these drugs are taken with fatty meals or milk. This helps to improve the absorption of those drugs, and eventually we also get adequate benefit of the treatment. In the event of vomiting within 1 hour of administration, we are advised to take a repeat dose. A patient takes a dose and vomits within 1 hour, that patient, within 1 hour, that patient must repeat the dose, please. But if it's above 1 hour, then the patient will rightly wait for the next dose. Right. So for features, I want to tell us our brand, Charlatan. Charlatan stands for quality. It stands for efficacy, and also it's also available. We have our reps all over the country. In every state, we have a rep, at least 2-3 reps that cover 2 contiguous states. So you can be sure that the product Charlatan will be readily available at all times. And I want to tell us that Charlatan offers dosage convenience of 1 tablet when you compare with other brands that comes for 4 tablets. So this ensures patient compliance, and also there's accurate dosing every time. Also, it's a trusted brand from Shalina. Shalina stands for quality, efficacy, and affordability, and thereby it ensures high quality standard, especially as I told us, these products are being manufactured from ISO certified factory. Right. Then Charlatan is also available in various formulations, tablets, dispersible tablets, and also in dry suspension, and thereby offers dosing convenience and compliance to patients. So our patients are at liberty to choose any of our brands. So I want to encourage us, please, to look, if you have malaria, please ask for Charlatan. Look out for Charlatan. By taking Charlatan for you, your family relations, you can be sure that you are given a very effective, qualitative regimen. And you can be sure that after 3 days, if it's malaria, after 3 days, that patient will get the requisite treatment after malaria. On a lighter mood, I want to challenge Dr. Afolabi. Dr. Afolabi thanked everybody in as many languages I can remember, but he failed to thank all of us in my Ondo language, the Egi language. So I want to challenge him to greet us, thank us in Ondo language before we end this session. So again, I want to thank you all on behalf of the manager Shalina. It's a privilege to be with you today, media initiative, and we look for further partnership with the media initiative. Thank you very much.
Thank you so much, Fam Ayo Akishola. That was a very good presentation on your product. And I want to also add that Shalina has distribution points aside Lagos. They have in Onisha for those down the south, down east. They have in Kano. They have in Aba. They have in Ibadan. They have in Abuja. They have in Far Meduguri. So you can, they have distribution points in different states, both in the north and in the south, the east, the west of the country. For distributors, please look out for Shalina depots and patronize them. I enjoyed, and I'm more learned, or I have more information on their products, especially the malaria products, and how you can take this. But I want to ask, I've been having this question in mind. Now, if you take a malaria or any tablet, any drug, within 2 minutes, and you throw up, you vomit it, do you need to repeat that dosage, or what happens? Because I know when malaria comes with all these symptoms of vomiting, and you take this drug, the next thing you throw it up and all that. And I'm always wondering, do I have to repeat this dosage again, or do I have to start all over, or do I continue?
Thank you, Dr. Oria, thank you. I mentioned in the course of the presentation that the moment the patient vomits within 1 hour, that dose must be retaken. You must retake. It must be taken. If you vomit within 1 hour, please, you must take another tablet.
Thank you so much for this presentation. And I want to thank Shalina Healthcare Nigeria Limited for us and for having time out today to come join this conversation and presentation of your products, your series of products and all that. Thank you so much, Fam Ayo Akinshola. And also, I think I've also seen Fam Alaron here from Shalina. Thank you for attending. Thank you so much. I want to ask Mr. CG if you still have your questions. Otherwise, we go back to Dr. Afolabi to give us a parting word today, and we call this we call it a day. And we promise from media initiative against malaria that, like somebody was asking, the person was asking, when next do we have this conversation? And I want to say that normally we used to have this conversation once in a year, but with this development from Dr. Falabi's presentation, I think we are going to have this often as possible. We may not just be having it once a year. I think we are going to have this as often as possible as the needs arise. And we're going to start meeting with probably schools and other sectors and come up with programs that will benefit the communities in the country and every other person. So we may be having this as often as possible. And direct, thank you.
Okay, thank you.
Okay, sir, you're welcome back.
I am just so impressed by everything I've heard, and this is absolutely fantastic because this is such an important issue and stressing the points of sanitation. But the key thing I'm witnessing is the individual responsibility, whether it's the media, the pharmacy, all aspects. So this has just been wonderful. And yes, I look forward to receiving copies of the proceedings so that we can broadcast it here in the United States, because my responsibility as president of APAHOC is to show African Americans that even in the midst of all the George Floyd killings and the violence, that we still have a home in Africa, and that we as African Americans and Pan-Africans across the globe must ensure that our mother is healthy, because it is from our mother that our lives come. So I just want to congratulate you, Ma, for putting this together. You've done an excellent job. It's just been wonderful and very powerful. So I steal some of my brother Afalabi's time, I know, but I think he would say that's okay. But this has just been great to meet everyone, and looking forward to seeing this happen again, and to whatever extent APAHOC can make contributions towards that effort. I want to make that commitment here and now. Thank you very much to each and every one.
Thank you so much, Dan Direct, President of AFAC. We are going to do everything possible to also collaborate with you people and some other people to actualize our dream on the fight against malaria. It's been a very deadly disease down here in Africa, and it's our desire that we find a way to eradicate this deadly disease in Africa. Thank you so much for all your contributions. Thank you so much, Dr. Afolabi. And I want to say that ask Dr. Afolabi, I don't know if Mr. Stevenson has anything to say. Otherwise, I'll ask Dr. Afolabi to give us a parting word. But if Mr. Stevenson has anything to say.
I think what I would like to say is that I must thank all the participants at this platform, especially my good appreciation goes to Shalina for partnering with us this year for this event. And I want to make this commitment that every quarter we will continue to have this kind of platform where we bring in professionals and doctors and scientists to deliberate on. The more we talk about it, the more we'll be able to find solutions to it. I must thank Dr. Greg for who joined us from the United States, and all others from Arizona and everywhere to deliberate on this matter from Saudi Arabia. We want to thank everyone. Media Malaria Summit is a global organization that tries to look at not only malaria, but also tuberculosis and the rest, because all these things are intrinsically linked to one. I want to thank Dr. Afolabi for always being there for us. He's an encyclopedia, if I want to use that word, of his issue. And I'm very sure that sometimes we can pay you back, for all the good work you'll be able to render to Media Malaria initiative. And for me, It's been an honor to have everyone speak today, and for us, we will continue to do what is right to ensure we found the lasting solution to malaria and what Africa can do. Sometimes I wonder how Italy was able to do it and why we can't do it even in one city in Africa. So thank you so much, and everyone that's part of it. Shalina, most importantly, like I said, and all our speakers from the United States, everywhere, we thank you for being part of this particular summit for today. But don't forget, we will be coming and knocking at the doors of everyone again in the next quarter to actually deliberate on these issues. Thank you.
Thank you so much, sir. I invite Dr. Falabi once again to just give us his last word for us before we draw the curtain here. Dr. Falabi, please.
Yeah, thank you so very much. I think the pharmacist Ayo was asking me to greet everybody in Ondo language, in his language, which is also my language because I'm from Ondo State too. Just a stone throw from where he comes from, being
Wow.
the Bashegun of Okebo, and I think he's from Ondo town. And Kenny Stevenson is just down the road around Okutupa from me. So this is a confluence of Ondo people, and it's been great. So don't worry, I'll do my research. I know how to say thank you in all the dialects in Ondo, and I'll speak to you on that later on. And I'd like to know. Be that as it may, I think this has been a fantastic meeting. And the key issue is that we should follow the WHO guidelines on test, treat, and track. We have to test everybody who comes with fever and diagnose that the person has malaria before we treat such a person. It's been known that not all fevers are due to malaria. About maybe 40, 50, or 60% of fevers are actually malaria. There are other diseases that bring fever. Tuberculosis brings fever, maybe measles, gastrointestinal problems, and so on and so forth. So, but you must be 100% sure that you are treating fever. Otherwise, if you give anti-malaria, even the new ACT, the artemisinin-based combination therapy, to somebody who does not have malaria, as time goes on, the malaria parasite will develop resistance to this ACT. As a matter of fact, in Indonesia and Southeast Asia, resistance to artemisinin-based combination therapy is being reported now. So we have to be very careful. We have to follow the WHO guidelines of test, treat, and track. And we have the pharmacists should actually be very aware of this, because people come to their pharmacies and their drugstores and then they just buy anti-malarials and take it. And we are saying no, please ensure that each patient that comes for an anti-malaria is tested before you sell anti-malaria to them. After treating, after giving them the ACTs, please track them. Get their phone number. Call them up once or twice. How are they doing? Now, you want to know if they did not take if the child did not take the medicine in your presence, and you say you should take it at home, you want to know that the child vomits the malaria medicine at home. If you just treat, or if you just gave this anti-malaria to the child or the child's mother and say, okay, when you get home, take this, give your child this medicine, and then maybe give the child medicine 8 hours after, then give the child medicine. The first dose, the child could have vomited it, and the mother would not report to you because the mother did not know your phone number and you did not call them. So when the anti-malaria does not work, they say, oh, that pharmacist sold us a bad drug. The pharmacy did not sell you a bad drug, but you did not follow the system, or the pharmacist did not tell you how to take the drug, when to take the drug, or what to do if the child vomits the medicine within the first hour or so. So that is very, very vital. And then we have to track these patients, children or adults, especially, yeah, maybe in some children, they will develop some adverse drug reaction. Even some adults, I've just written a paper which is being reviewed now on adverse drug reaction to artemisinin-based combination therapy in Nigeria. It will be set for publication maybe a week or 2 weeks from now. And what we are seeing is that many people develop moderate or severe adverse drug reactions, which could be life-threatening. And if we don't track them, we lose these patients, or these people will lose confidence in us. It's very important also, as Ayo said, that those who are taking artemisinin-based combination therapy, they take fatty food or milk before taking this. You see, these are very, very important issues that came about through research. Okay? So we have to actually be teachers, all of us, pharmacists, nurses, every one of us who must teach the community. Also, we have to ensure that children sleep under long-lasting insecticide net. The government has been doing a lot of work on this, especially Lagos State government. To be very honest with you, Lagos State government have been doing a lot of work. I used to be a consultant. They've been doing a lot of work, and I want to commend them, because Lagos State has a large population, but they're able to do it. One other thing that we are doing is indoor residual spraying. I don't know if they're still doing it, but it should be done. It should be done. So I think with this, it's been fantastic. Also, we have to take care of our pregnant women. We know how precious our pregnant women are to us. We know how precious women in general are precious to us. Without women, where will we be? What will happen? Who will take after us? How will we have our children to take over from us? So we have to take good care of pregnant women and make sure they are healthy. Pregnancy should be a thing of joy. It must never be a disaster. So we have to make sure that our pregnant women are healthy, and we give them reasons why they should sleep under long-lasting insecticide-treated bed nets. We give them good reasons why they should take their intermittent preventive treatment. The first dose, the second dose, and the third dose during pregnancy. I want to thank you very much. I want to thank Media Initiative Against Malaria very much. I think I'll be with you for a little while, because there are a lot of things to do. And I want to thank everybody who has listened to us, not only from Africa, but also from USA, from Europe, from Saudi Arabia, from everywhere. Thank you so very much. I'm very, very grateful. Thank you.
Thank you so much, sir. Thank you, Dr. Falabi. That was very, very educative. Thank you so much. Yes, you want to clap, you can clap. Honestly, it's been a very educative period, and I don't even feel like leaving this session. I just think it should just continue on and on and on. But considering the fact that a lot of people are at work and we have to do our jobs too, we are bringing this to an end. But I'm going home with this particular aspect of this discussion, the triangle of education, agriculture, and health. Like I said, that is going to be my password. And like in his conclusion, or his concluding aspect of some people being very particular about the brand, especially when Farm Ayo made his presentation. Like he said, people take some of these drugs, and what you hear is that they are not working or they are bad. There are no actually bad pharmaceutical drugs. the important thing we should also go home with, especially the pharmaceutical companies, is to also do a kind of statistics or analysis on the incidence of these drugs. I don't know if you have ever done that. You go out, do data collection, and do analysis and see how many people actually took these drugs and they actually got healed, or well, it worked, and how many people took these drugs and they do not work. Because most times you just find your drugs at the shelf and nobody picks them up. Why? Because people have used and they felt there was no, it was important. But because of the way they took the drugs, I know that some people, when they take these drugs, they take 8 hourly. Some people forget and take it 24 hours interval and all that, and they don't work. So it's important we go back also to do our research and know why people are taking our brand or people are not buying our brands. And also it's important that we take this awareness, creation of awareness down to the grassroots on how to take these drugs. It's not enough to manufacture. It's also important that people are educated on how to take these drugs. And probably you also create a platform where people come around and educate the masses on how to take these drugs so that the drugs will be potent. Once again, I want to thank Shalina Healthcare for partnering with us. I thank Inside Business Africa, and I thank Dan Durrett. I thank Eric from Arizona. I thank Dr. Afalabi so much for his time out to be here with us. And we promise that we're going to hold this quarterly all through the year. And we are coming back to you, knocking at your door, and we know that you will also respond to us. So do have a good day. It's still afternoon, and God bless you for attending, and everybody that attended. Thank you so much. From here, Media Initiative Against Malaria, we say thank you for attending. Thank you for your contributions. Thank you for partnering with us. Thank you for sponsoring. Thank you for your questions and your time. God bless. Do have a good day. Thank you.